In order for the heart to pump blood through the body, it first has to provide blood to itself so that it can obtain oxygen and nutrients. The myocardium is supplied with blood by two main coronary arteries that arise at the root of the aorta. The left main coronary, which then divides into the left descending and the circumflex, and the right main coronary artery. The main coronary arteries run along the surface of the heart as large epicardial arteries. They also send smaller branch arteries into the myocardium, the intramyocardial arteries. These further divide into a dense network of arterioles and capillaries. This system of vessels provides blood to the myocardium, a process known as perfusion. Myocardial blood flow can be affected by several factors. In a healthy heart, the most important include changes in aortic pressure and compression of myocardial vessels during systole, and changes in oxygen demand. During diastole, the heart muscle relaxes and blood flows into the heart chambers. During the cardiac cycle, the contracting and relaxing heart muscle influences its own blood supply by changing the pressure in the aorta, which affects the flow of blood into coronary arteries, and alternately compressing and releasing the blood vessels in the myocardium. During the systolic phase, the pressure of the contracting cardiac muscle compresses the intramyocardial vessels. In addition, the increased pressure in the ventricles causes further compression of the coronary vessels, thus reducing myocardial blood flow. The heart myocardium needs a significant amount of oxygen to do its work. The cardiac muscle extracts and uses 60 to 80% of the oxygen in the blood flowing through the coronary arteries. By contrast, skeletal muscle extracts only 25 to 30%. Hence, blood flow to the heart myocardium is tightly connected to the cardiac muscle's need for oxygen. The heart myocardium has autoregulatory mechanisms that affect blood flow based on the amount of oxygen that is needed. During periods of increased activity or stress, the cardiac arteries dilate and increase their flow of blood. Ischemia occurs when arteries are unable to dilate to meet myocardial oxygen needs.